The most popular strategy that doctors use to treat sexual side effects from antidepressants is waiting for spontaneous remission. However, this is one of the least effective methods and only works in up to 20% of people. So today, I'm going to give you 3 medication tips that have actually been proven to be useful and effective in boosting your sex life. Tip number 1 is to reduce the dose of your medication. There was a study that showed that cutting the antidepressant dose in half improved treatment-emergent sexual dysfunction in 75% of cases. And in those who stopped their medication altogether, they had total recovery after a few days or weeks. Now, this strategy should only be used in those who have already achieved full remission on their medication, because lowering the dose obviously carries some risk of your symptoms returning or worsening. So if you're someone who just started a medication or are still having symptoms that you're trying to get under control, you're gonna wanna consider tips 2 and 3. Tip number 2 is to add a helper medication. Now, there are 2 medication strategies that have been proven over and over again to have a clear, statistically significant benefit when it comes to reversing sexual side effects from antidepressants. The first is adding on bupropion or Wellbutrin to your medication regimen. And this is one of my favorite approaches because it can give you a triple whammy effect. And this is helpful for both men and women. It's been shown to 1, improve sexual side effects, 2, increase sexual desire and improve overall sexual functioning, and 3, enhance treatment of your depressive symptoms because bupropion itself is an antidepressant medication. If this approach is something you're interested in, one thing I want you to know about so that you can bring it up to your provider is that lower doses of bupropion might not be as effective as higher doses. While some people in studies saw benefit with lower dosing, there have been other studies conducted that have not shown improvement of sexual side effects at doses of 150 milligrams daily. When we're looking at the extended release version of bupropion, the doses that we want to be using are 300 milligrams to 450 milligrams daily. Now, if you're looking for a way to keep track of all this information, make sure to click the link below to download my free PDF that has all of this information in it. The next medication strategy that has a ton of evidence supporting it is the addition of a phosphodiesterase inhibitor to your medication regimen. So these would be things such as sildenafil or tadalafil, also known as Viagra and Cialis. The Journal of Clinical Psychiatry came out with a randomized controlled trial looking at men who developed erectile dysfunction while taking an antidepressant. And they found that those who were on sildenafil had improvements in both erectile dysfunction and overall sexual satisfaction. What's even more interesting is a study that was put out by JAMA that looked at women who took sildenafil, and they also found improvements in sexual side effects. Now, when comparing sildenafil head-to-head with tadalafil, what you're going to see is that sildenafil is the best studied phosphodiesterase inhibitor. However, if you're someone who wants some spontaneity in your sex life, tadalafil is a great option because its effects last up to 36 hours. The recommended dose of tadalafil is 5 to 20 milligrams, 30 minutes to 36 hours before sex, where sildenafil is 50 to 100 milligrams, 30 minutes to 4 hours before sex. Okay, so there are 3 other helper medications worth mentioning that are commonly used that don't have quite as robust evidence supporting them. However, people have reported benefit from them, so they're options I want you to know about. The first is mirtazapine or Remeron. There was a retrospective study showing that people who took 15 to 45 milligrams of mirtazapine in addition to their primary antidepressant had improvement in sexual side effects. However, there is yet to be a randomized controlled trial supporting this strategy. The next is testosterone, and there are actually randomized controlled trials supporting this in both men and women. In men, testosterone gel was found to be helpful in those who were depressed and had low or low normal testosterone levels. In women, they found that testosterone patches helped improve low libido. The third helper medication that I want you to know about is buspirone or Buspar. There was a placebo-controlled trial that showed it was helpful in improving sexual side effects caused by paroxetine or citalopram. These effects were more pronounced in women than in men, and dosing for this medication is between 15 to 60 milligrams daily, and this is usually divided into twice a day or 3 times a day dosing. Now, tip number 3 is to discontinue your antidepressant and switch to one that is associated with a lower risk of sexual side effects. There are 5 medications that have been shown to have lower rates of antidepressant-induced sexual dysfunction. I covered these in my best versus worst video, so make sure to head on over to that one to find out more.